Hi, my name is Ethan Barton. Today I'm going to be performing my IV checkoff. So first I'm going to show you my ID. Then after I've done that, I'm going to scan the room. And now I'm going to set this back down. The contrast is fairly bad, but once I turn it down on the table, it's a lot easier to see what I'm working with. So now that I've done that, I'm going to get my patient care order form, and I'm going to look at that order for the IV. Turn the camera again. Here we go. Look at the order for the IV, also the hospital policy on how to insert that IV. And then I'm going to gather all my equipment. I have a waterproof pad under the patient's arm already. And after I've done that, perform hand hygiene before I go to my patient. And I'm going to identify using two identifiers. I'm going to use his birthday, 8/25/1963, 8/25/1963 on the armband. His medical record number is 417-6352, and I see his 417-6352 on the armband. Mr. Jones, today I'm going to be inserting a catheter in a little bit, and I will explain more as we get closer to the procedure. I also see that you are allergic to penicillin on my order form, and your armband shows that you are allergic to penicillin. Now I'm going to provide privacy for you. And then after I've done that, I'm going to position my trash can with my feet since it's already close by. And after I've done that, I'm going to apply my goggles. Once I apply my goggles, I'm going to raise the bed to working height and then lower the side rail and position the patient comfortably. They can be sitting or in supine position. Now I'm going to open my sterile packages. So after I've done that, I'm going to clean my J-hook with my alcohol prep pad. And dispose of that, and then immediately connect my syringe. And I'm going to flush with saline. There's a drip, and I'm going to place that back in the package. After I've done that, I'm going to remove the needle from the dressing, catheter, set that on the table for use, close to the patient, and then this is my, also like to say, this is my workspace, and this is my patient. Normally my workspace would be above waist level. Also, now I'm going to say three principles for finding a vein. I would use the most distal site, use the non-dominant arm if possible, and also move the camera, and also a large, soft, bouncy vein. I would also look for three principles for fostering venous distension. I will stroke the vein lightly, place the extremity in a dependent position, and also have the patient open and close their fist slowly. And now I'm going to move the camera back down and then show how I'm going to apply the tourniquet. 4 to 6 inches above the injection site. So if this is the injection site, I'm going to go up here about 4 to 6 inches. I'm going to have to bear down on the patient's arm a little bit because this is a pool noodle and not a patient. But I'm going to pull it tight and then have a quick release knot for the tourniquet. And also, then I'll take the radial pulse. After I've done that, if I need additional prep time, then I would release the tourniquet and apply it again later so that the patient would not be in any pain. Now I'm going to move that camera and then apply my clean gloves. I'll move the saline lock nearby the patient on the pad right here, and then I have my needle close by as well. I'm going to get my chlorhexidine. You can hear a clicking noise, and then I'm going to clean the injection site thoroughly, sideways, up and down, and in circular motions for 30 seconds. And then dispose, and that will allow that to completely dry, and then I would not touch this site again until I'm ready to, until I insert the stylet. Now, Mr. Jones, please remain still for me. I'm going to, you're going to feel a little prick as I insert the needle. I would insert the needle bevel side up. I'm going to pull back the skin, insert at a 10 to 30 degree angle, Once I see venous blood return, I would lower the needle and advance another 1/4 inch. And then after I've done that, I'm going to place pressure. We'll put my finger ready to place pressure up here. I'm going to turn the patient's arm so you can see what I'm doing right now. I'm going to have pressure, and then I'm going to advance the catheter without the stylet, pulling with my dominant hand. And then I'm going to pop the tourniquet, and then slowly pull out the stylet and place in the sharps container. And then keeping pressure, I'm going to remove right here the cap of the J-hook, and then I'm going to secure it to the catheter. Once I've done that, I'm going to secure that with temporary tape. And then I'm going to aspirate for blood return. I see blood return, and then I would flush the vein and observe for any swelling. After I've done this, I'm going to remove the syringe and place it in my sharps container. Now I'm going to get my Tegaderm and apply that. I'm going to make sure that I apply the Tegaderm only over the blue hub. Make sure I can still have access to the saline lock. Throw away my package from my J-hook, as well as pull off the time and date stamp. And then I would place that on the dressing and then write the time and date of the IV insertion. Now I'm going to dispose of all my equipment, as well as my gloves. Oh, wait, sorry. Before I would do that, I would remove this temporary tape. And then I would get some more tape and then tape that J-hook in a natural position. Not pulling on the IV site, I would make sure that I have everything. There it is in the natural position on the arm. So once I've done that, I'm going to dispose of the rest of my equipment that I've not gotten yet, and then I would dispose of my gloves as well. And then I'm going to reposition my patient in a comfortable position, and then I'll take off this tourniquet, and I would raise the comfortment to put the patient in a comfortable position. I would raise the side rail and then lower the bed to its lowest setting. And then I'm going to instruct Mr. Jaguar Jones on how to prevent dislodging of his IV, and also signs and symptoms of IV-related complications, such as, I'm going to turn the camera so you can see me, such as infiltration, phlebitis, or inflammation. And then I perform hand hygiene, and then I would document the date of the procedure, the time, I would describe the location, so the insertion site, the number of attempts that I took to find a vein, the catheter gauge and length, how the patient tolerated the procedure, the presence of a saline lock or flow rate, as well as how the fluids are infused, determine the method of infusion if the fluids are prescribed. Now, for discontinuing the IV, I'm going to apply clean gloves. And I already have my goggles on, so I don't have to apply that right now. And the towel, I would place the towel under the patient, as there's already one right here. And then I'm going to remove the tegaderm towards the insertion site, like so. And dispose of that. Then I'm going to get some gauze, and I'm going to place the gauze over the site and remove slowly. Oh, sorry. First, I'm going to take off the tape, keeping the J-hook on. It is sticking to the noodle. Then once I've done that, I'm going to gauze over the injection site and then slowly remove. And then I would inspect the catheter, seeing for any damages, and also make sure it's all there so none of it's left in my patient. And then I'm going to observe the patient's skin, looking for redness, pain, any swelling or any bleeding. And then I would apply gauze over the injection site with the tape. So after I have disposed of my catheter, I'm going to remove this gauze, dispose of that as well, get another piece of gauze, apply that over the site, and then I'm going to get another piece of tape and secure that gauze over the patient. So once I've done that, I'm going to make sure that the patient's call light is in reach, and then I would document the procedure. After I have put my patient back in a comfortable position, if I did have to raise the bed and lower the side rail, I would raise the side rail back up, lower the patient back down, and then I would move on to document my procedure. And then this concludes my IV checkoff.